सत श्री अकाल नमस्कार तुसीं देख रहे हो पंजाब स्टार टीवी। मैं हर्षदीप सिंह तुहानूं सब नूं जी आयां नूं। कैनेडा बुलेटिन की शुरुआत करते हैं हैडलाइनस के नाल। ब्रैम्पटन ने मेयर पैट्रिक ब्राउन ने प्रोविंशियल सरकार वालों टेस्टिंग वधाउण के फैसले का किया स्वागत। कहा हॉटस्पॉट्स बारे भी सिटी वासियों को दी जाएगी जानकारी। एनडीपी आगू जगमीत सिंह ने आख्या कि लॉन्ग टर्म केयर्स होम विच आर्मी की रिपोर्ट नालों प्रधानमंत्री का बयान ज़्यादा खतरनाक। क्या फैडरल लीडरशिप दिखाने तो भज रहे हैं प्रधानमंत्री। ओंटारियो दे विच एक बार मुड़ तो नवे आए केसां की गिणती रही 300 तो हेठा। हैल्थ अधिकारियों वालों प्रगटाई गई खुशी। हुण जानने खबरां विस्तार दे नाल। ब्रैम्पटन के मेयर पैट्रिक ब्राउन वालों आख्या गया कि उन्होंने हॉस्पिटल के CEO और पील चीफ मैडिकल अधिकारी डॉक्टर लॉरेंस लो नाल गलबात की है, जिस विच उन्होंने ये कहा कि जल्दी तो जल्दी एक रिपोर्ट तैयार की जाए कि आखिरकार शहर च किहड़े-किहड़े हॉटस्पॉट ने तो इन्हां बारे लोकां नूं जानकारी दी जा सके। इस मौके मेयर पैट्रिक वालों टैसटिंग वधाउण संबंधी प्रीमियर के फैसले का स्वागत भी किया गया। उन्होंने आख्या कि सिटी के सारे मुलाजमां नूं भी टेस्ट करवाउण दे लई कह दिता गया।
I should also note I've had a number of inquiries from residents since the Premier mentioned that Brampton was one of the hotspots, asking where are those hotspots. I wanted to say that I've spoken to the CEO of the hospital and to Dr. Lowe on the importance of transparency and making that information available as soon as possible, and I'm heartened to hear that we have their commitment to make that data available as soon as possible so residents know where there are areas of greater concern and areas where the virus seems to be circulating in the community at a greater rate. I should also note that I've been speaking to the Premier almost every day about how we deal with this hotspot. And one of the tools that I really welcome is the Premier's commitment for increased capacity for testing. Just speaking this morning to our hospital CEO, I understand that yesterday was one of the busiest days for testing. 1,184 people were tested at the assessment centre in Brampton, and we're certainly going to take the Premier up on his offer for increased testing. On Monday, I wrote our employees at the City of Brampton asking if they would participate in the testing. In order for public health to be able to trace and track the virus, we need to know where it is. And that's why we've taken the unusual step of asking all our city employees to get tested. Since the government has said that it's no longer going to be a condition that you have symptoms to be tested and you can get tested without symptoms, we're certainly supporting that wholeheartedly and encouraging our community to get tested.
पील रीजन के चीफ मैडिकल अधिकारी डॉक्टर लॉरेंस लो ने दस्सिया कि ब्रैम्पटन विच 2089 केस सामने आ चुके हैं तो 1461 ठीक हो चुके हैं और हुण तक 17 मौतां भी शहर विच होईयां ने। उन्होंने आख्या कि केस लगातार वध रहे हैं तो केस लभण दे लई टैसटिंग वधाउण दा फैसला शलाघायोग है। जिन्हें आख्या कि जिन्ने ज़्यादा टैसट किए जाणगे उन्ने वध केसां नूं ट्रेस करन तो बाद लोकां नूं सुरक्षित कीता जा सकता है।
As of this morning, we have observed 2,089 cases in Brampton. 1,461 of those have recovered, and 70 Bramptonians have tragically passed away. I first want to begin my remarks by thanking our paramedics for their service. This is Paramedic Services Week. Working hand in hand with Peel paramedics in addressing COVID-19 has been an honor and privilege for us at Peel Public Health. So Brampton, Peel's 7-day moving average of new cases has trended upwards over the last week. And I want to be clear, that is not the direction that we want to see things going in. Our investigation has identified that this is being driven by new outbreaks in household clusters and also centered in workplaces. While we continue to dig down for the root cause of these outbreaks, direct cases to isolate, and trace and advise for contacts on next steps, I want to be absolutely clear that we are far from being out of the woods with COVID-19. Also, with the upward trend, I wish to state that I very much welcome the province's recent announcement to broaden COVID-19 testing to any symptomatic individual, any asymptomatic individual who has had close contact with someone who may have COVID-19 or has confirmed COVID-19, or asymptomatic individuals at risk based on their work. More testing will help us identify cases more easily and allow us to stop spread and protect residents. I do want to also state, though, that as we support more testing, we also must test more of the right people. And to that end, I urge Bramptonians to be patient and thoughtful in seeking testing. In speaking with our hospital partners, I have been advised that area assessment centers will continue to test all who need to be tested. And if you are considering a test, however, I encourage you to carefully consider your risk. We hope to afford opportunities as much as possible to those who are symptomatic or who are at risk, first and foremost.
ਕੌਂਸਲਰ ਹਰਕੀਰਤ ਸਿੰਘ ਵੱਲੋਂ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਗਈ ਕਿ ਸਿਟੀ ਦੇ ਵਿੱਚ 56 ਚਾਰਜ ਐਮਰਜੈਂਸੀ ਮੈਨੇਜਮੈਂਟ ਐਂਡ ਸਿਵਲ ਪ੍ਰੋਟੈਕਸ਼ਨ ਐਕਟ ਤਹਿਤ ਸੋਸ਼ਲ ਗੈਦਰਿੰਗ ਦੇ ਸੰਬੰਧੀ ਸ਼ਿਕਾਇਤਾਂ ਤੋਂ ਬਾਅਦ ਲਗਾਏ ਗਏ ਨੇ ਅਤੇ ਸੋਸ਼ਲ ਗੈਦਰਿੰਗ ਸੰਬੰਧੀ ਸ਼ਿਕਾਇਤਾਂ ਦੇ ਵਿੱਚ ਵੀ ਵਾਧਾ ਹੋਇਆ ਜਿਨ੍ਹਾਂ ਦੀ ਗਿਣਤੀ 291 ਹੋ ਗਈ ਹੈ 27 ਚਾਰਜਸ ਪਾਰਕਿੰਗ ਲਾਟ ਗੈਦਰਿੰਗ ਇੱਕ ਅਨਲਾਇਸੈਂਸ ਬਿਜ਼ਨਸ ਜਾਰੀ ਕੀਤਾ ਗਿਆ ਤੇ 3 ਚਾਰਜ ਪਾਰਕ ਵਿੱਚ ਇਕਵਿਪਮੈਂਟਸ ਦੀ ਵਰਤੋਂ ਕਰਨ ਲਗਾਏ ਗਏ ਨੇ
Good morning, everyone. I'd like to thank our bylaw team and first responders for the outstanding job that they are doing to keep our community safe and to ensure we are mitigating the spread of COVID-19 by preventing large gatherings. Between May 19 and 25th, there were a total of 56 charges laid under the Emergency Management and Civil Protection Act. We saw an increase in complaints received for residential social gatherings from 163 to 291 this past week. As a result, 25 charges were laid. Additionally, 27 charges were laid related to parking lot gatherings. One particular evening, 23 charges were laid by bylaw enforcement officers who partnered with Peel Regional Police to respond to these gatherings. There was also one charge for an unlicensed business selling produce in a parking lot and 3 charges for using equipment at a park. I would like to take this opportunity to reiterate what is and is not allowed in terms of social gatherings in Brampton. Under the Emergency Management and Civil Protection Act, social gatherings of more than 5 people are prohibited. This means that a meeting or assembly of more than 5 people who do not live together in public or on private property is prohibited. This also includes parked vehicles as well.
ओंटारियो ਦੀ ਐਸੋਸੀਏਟ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਯਾਫੀ ਨੇ ਦੱਸਿਆ ਕਿ ਪ੍ਰੋਵਿੰਸ ਵਿੱਚ 26483 ਕੁੱਲ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ ਹੋ ਗਈ ਹੈ ਤੇ ਬੀਤੇ ਦਿਨ 292 ਕੇਸ ਸਾਹਮਣੇ ਆਏ ਨੇ ਲਗਾਤਾਰ ਦੂਜਾ ਦਿਨ ਸੀ ਜਦੋਂ ਪ੍ਰੋਵਿੰਸ ਵਿੱਚ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ 300 ਤੋਂ ਹੇਠਾਂ ਰਹੀ ਹੈ ਬੀਤੇ ਦਿਨ 1.1% ਦਾ ਵਾਧਾ ਕੇਸਾਂ ਦੇ ਵਿੱਚ ਦਰਜ ਕੀਤਾ ਗਿਆ ਇਸ ਤੋਂ ਇਲਾਵਾ 65% ਕੇਸ ਗ੍ਰੇਟਰ ਟੋਰਾਂਟੋ ਏਰੀਆ ਦੇ ਨਾਲ ਸੰਬੰਧਿਤ ਨੇ ਤੇ ਬੀਤੇ ਦਿਨ 82% ਕੇਸ ਪੀਲ ਟੋਰਾਂਟੋ ਅਤੇ ਯਾਰਕ ਰੀਜਨ ਦੇ ਵਿੱਚ ਪਾਏ ਗਏ ਨੇ ਇਸ ਤੋਂ ਇਲਾਵਾ 20,372 ਅੰਟਾਰੀਓ ਵਾਸੀਆਂ ਨੇ ਕੋਰੋਨਾ ਵਾਇਰਸ ਤੇ ਜਿੱਤ ਹਾਸਲ ਕੀਤੀ ਹੈ ਇਸ ਮੌਕੇ 847 ਮਰੀਜ਼ ਹਸਪਤਾਲ 'ਚ ਦਾਖਲ ਨੇ ਜਿਨ੍ਹਾਂ ਵਿੱਚੋਂ 150 ICU ਅਤੇ 117 ਵੈਂਟੀਲੇਟਰ ਉੱਪਰ ਨੇ ਬੀਤੇ ਦਿਨ 32 ਮੌਤਾਂ ਵੀ ਹੋਈਆਂ ਨੇ
Our total is 26,483 confirmed cases of COVID-19 reported in Ontario. This represents an increase of 292 cases over yesterday, which is 1.1% increase. So we have the second day in a row with an increase that's below 300 cases. And while encouraging, of course, we have to keep watching the numbers closely and ensure that this trend keeps up. In terms of the case demographics, they continue to be similar. 56% of our cases are female. Almost 41% are in people 60 years of age and older, and over 65% are people who reside in the Greater Toronto Area. Of the 292 new cases today, 82% are from 3 public health units, Toronto Public Health, Peel Public Health, and York Region Public Health. The number of healthcare workers who have tested positive to date is 17% of our cases, or 4,536 cases. Again, this is a cumulative number and not the number currently positive. We do continue to see Ontarians recovering from COVID-19 with 77% or 20,372 cases considered resolved. We currently have 847 people in hospital. That's a reduction of 150 people in ICU, and 117 of them are on a ventilator. And tragically, we do continue to see deaths related to COVID-19. To date, 2,155 deaths have been reported, which represents an increase of 32 deaths from the previous report.
NDP आगू जगमीत सिंह ने कहा कि आर्मी वालों लॉन्ग टर्म केयर होम्स बारे सौंपी रिपोर्ट तो खतरनाक प्रधानमंत्री जस्टिन ट्रूडो का रिस्पॉन्स है, जिन्हें आख्या कि प्रधानमंत्री ने फैडरल लीडरशिप दिखाने की थां एक्शन करने की थां एक्सक्यूज़ देने नूं पहल दी है। सिंह ने कहा कि असी प्रोविंशियल सरकार के एक्शन का इंतजार नहीं कर सकते, जरूरत है कि फैडरल सरकार कदम चुके तो इसलिए लगातार वो मंग उठाते रहणगे।
The horrific details of what the military outlined when it comes to seniors, it's appalling. But what's more appalling is when the federal government, when the Prime Minister tries to use jurisdiction as an excuse not to act. Like, how dare the Prime Minister respond to a question about whether or not we can show federal leadership by quoting jurisdiction? How could the Prime Minister quote jurisdiction to families that have lost loved ones, to some of the most vulnerable people in our society who are dying in long-term care because of the neglect that the military, the way they've detailed it, sounds a lot like criminal negligence. And that's why our team has written letters to the Minister, Bill Blair, saying that this report should merit being referred to the RCMP for investigation and potentially charges being laid. This is appalling, and what's further appalling is if the federal government does not act. And so again, I'm going to redouble my efforts to call on Prime Minister Trudeau and the Liberal government that we need to act now. It's not enough to say we'll wait to help the provincial governments. The federal government needs to play an active role in leadership in doing two things. One, to remedying the situation, to fixing the situation, working on a national care guarantee, working on bringing long-term care into the Canada Health Act and that similar principle of universal access, publicly delivered care. This would not have happened in a hospital. And there's a reason. The type of scenario, the horrible, appalling details would not have happened in a hospital for a very clear reason. Hospitals aren't built to create profit. They aren't made to make money off the backs of patients. It's there to deliver care. And that's what long-term care should be about.
प्रधानमंत्री जस्टिन ट्रूडो वालों भी रोजाना वांग पत्रकारां दे नाल गलबात कीती गई, जिथे उन्हां लॉन्ग टर्म केयर्स होम दा मुद्दा प्रीमियर्स नाल होण वाली मीटिंग च उठाउण दी गल आखी है। इस तों इलावा प्रधानमंत्री जस्टिन ट्रूडो वालों फैडरल सरकार दीआं लोकां नूं आर्थिक सहायता देण संबंधी स्कीमां दा जिक्र भी कीता गया।
Tomorrow, I plan on raising what's happening in nursing homes and long-term care facilities with the premiers during our weekly call. I will once again offer our government's support as they try to get the situation under control. As I've said many times, we need to do a better job of caring for seniors. They raised us, they built this country, they deserve better. During the first few weeks of the crisis, people's lives were turned upside down. Hundreds of thousands of Canadians lost their job through no fault of their own, without warning, because of this pandemic. It put enormous financial pressure on everyone from students to young professionals to families. So we brought in the Canada Emergency Response Benefit to support people until they're able to get back to work. And to help as many Canadians as possible keep their jobs or get hired, we introduced the Canada Emergency Wage Subsidy. We also unveiled our $9 billion plan to help students and recent grads get through the next few months. We now have over 45,000 jobs available for young people. If you or someone you know is interested, go to jobbank.ca to apply.
फिलहाल दे लई कैनेडा बुलेटिन दे विच इन्ना ही देश दुनिया दीआं ताज़ा तरीन खबरां ते मनोरंजन भरपूर प्रोग्रामां दे लई बने रहो पंजाब स्टार टीवी दे नाल। धन्नवाद।